Hi, guys. My name is Jerome, and don't worry, you are indeed on the Composition Consultant YouTube channel. Now, the reason that I'm here today instead of Jonathan is during one of his more recent live Q&A videos, he was asked how he would train somebody that had a hip replacement. And he brought me up by name because he knows I have a personal training studio, and most of my clients have come to me because they have some kind of limiting health condition that prevents them from doing conventional exercise. Things like lupus, rheumatoid arthritis, bad knees, shoulders. And as fate would have it, I actually have a client that has had a hip replacement. So, in speaking with Jonathan in private, I asked if he would be okay if I put together a presentation, not just how I train my client that has had a hip replacement, but in general gave principles that somebody with essentially any health condition could still safely reap the benefits of exercise without making their particular condition worse. And that's what we're going to talk about today. So please, I know I'm not Jonathan, but bear with me. How I train clients with hip replacements, and by extension, how I train essentially anybody with some kind of injury or limiting factor. A little bit about me. My name is Jerome. I have my bachelor's in kinesiology, currently working on my master's. I have a master personal trainer certificate in high intensity training, a single dad, own my own personal training studio, blah, blah, blah. Nobody cares, right? Today, we'll cover how I train clients with joint issues. I'm really going to go into the protocol and explain why I do the things that I do. I'm going to give you a direct example of how I train my client who has had a hip replacement. And bigger picture, we're going to talk more broadly about how to apply the methodology and this style of training into your own training. Now, a quick disclaimer, I'm not Jonathan, and the presentation reflects my thoughts and my opinions and does not necessarily represent those of the composition consultant. Big picture, what are we trying to do here? Our goal is to maximize the positive benefits of exercise with the least amount of risk and the least amount of stress or strain on a joint. Exercise, when properly performed, should have a net benefit to your joint health. And this is essentially all of physical therapy, right? Oftentimes, when people have a knee replacement, they're performing resistance training that same day as the surgery because not only do you have to keep the tendons loose so they don't tighten up as they heal, but you need to start rebuilding the joint integrity using strength training. So, anybody, not just people that have joint issues, if you're performing exercise correctly, it'll have a net benefit on your joint health. Broadly, how do we do that? It starts with getting a proper diagnosis. Now, obviously, if you have a hip replacement, you know what the issue is. You've had a hip replacement. But if you just have kind of aches, pains, something that doesn't feel right, this may require getting a proper diagnosis from your doctor. You may have to get some imaging tests done, talk to your physician's assistant or a physical therapist to really figure out what's going on. From there, you identify the physiologic function of that muscle or how that joint articulates, train it directly and as safely as possible. Most muscles have one to two functions, sometimes more, depending on their physiologic attachment points. So, if you think about the biceps, right, the main function of the bicep is to supinate the wrist. It also functions in elbow flexion, and because it crosses the shoulder girdle, humeral, the upper bone in the arm, humeral extension. So, as long as you're performing movements that serve that physiologic function and you can do that in a safe way, it'll have a net benefit on that joint or on those muscles. If you're trying to strengthen a joint specifically, you want to strengthen all the muscles that articulate that joint in all naturally occurring directions. And to use this, you have a wide variety of tools at your disposal. You have exercise bands, you have exercise machines. You might be doing static movements, which is essentially pushing or pulling against something, even though there's no movement. You may be using free weights. You might be using something called a timed static contraction, which is a very specific protocol of isometric exercise or exercise without moving. Now, the reason that we're doing this is because of Wolff's law of resistance. And Wolff's law basically says that your bones will become stronger as a positive adaptation to physical stress. So, if you are challenging your muscles, muscles will release hormones called myokines that have a positive effect on your bones. Muscles pull on the tendons, tendons pull on the bones because this is physical stress. If you give your body the time and recovery resources that it needs, your bones will become stronger as a result. These myokines are essentially signaling hormones that are released by the muscles through resistance training, through exercise. And they have an autocrine, a paracrine, and an endocrine function. Autocrine means that they signal their own cell. Muscles release hormones that have positive benefits within that cell. Paracrine means they have a positive benefit around the area. Muscles will release these myokines that will strengthen your tendons. It'll signal more synovial fluid to be released in joints, so your joints become a bit more lubricated, and it will signal your bones to become stronger. And then endocrine means that it has functions across the system as a whole. Again, exercise is a physical stress on the body, and you have to allow proper time to recover. If you put too much stress too often on an injured body part before it's ready, you absolutely can make that condition worse. The last thing we do is here is I teach empowering habits to people and I try and dissuade negative ones, but I'll wrap those up in the presentation. More specifically, I need a confirmed diagnosis. And the way that I go about that sometimes is I have a form called a PAR-Q Plus, and this is free for anybody if you just search for PAR-Q Plus. It's essentially a detailed health questionnaire that gives a pretty good idea of a number of potential health conditions that may prevent somebody from performing conventional exercise. Depending on the results of that, I'll do a functional assessment. I'll have people demonstrate where they have certain issues of mobility in certain joints, if that's the particular issue. And sometimes I'll talk to their doctor or their physical therapist so I can get a better idea of what's actually going on, how we can work around it. But in general, I'll use as full of a range of movement as I can that doesn't produce discomfort. So somebody, let's just say, has a shoulder issue, and maybe their arm feels fine as they're raising it out to the side, but once their arm gets straight out to the side or a little bit higher, it starts to become really uncomfortable. In that instance, I'll work a lot of the muscles of the shoulder through a wide variety of planes, but I won't quite get all the way close to that point where it starts becoming uncomfortable. Because of myokines, because of Wolff's Law of resistance, if we're safely working the muscles hard enough, it'll have a localized effect in a positive way on that particular joint. We avoid the area near where the pain or discomfort begins. Now, depending on the condition, sometimes people have pain moving just the slightest bit, and we may have to use isometrics. I mentioned this before, but an isometric exercise by definition has no movement. We're pushing or pulling against an immovable object. Oftentimes we prioritize, whatever the compromised area is earlier in the workout. And the reason that we do that is the individual's focus and concentration is the highest. So as workouts tend to go on, a workout to be maximally productive has to be relatively intense. You have to produce a high degree of effort to get a decent positive benefit from that workout. This also means the longer the workout goes on, a lot of times people are starting to lose focus or starting to lose concentration. They kind of want the workout to be over. So I try and, if anybody has any kind of limiting health issue, I try and put that first in the workout so they're fully focused, fully concentrated, fully ready to just put their effort into that one movement instead of thinking, God, I wish this workout was just over by now. And then oftentimes I'll limit other exercises as necessary. Your body has a fixed ability to recover from a physical stress at a time. You can only heal so fast. So sometimes if I'm prioritizing one area, I will take and reduce volume of certain other exercises throughout the rest of the body so that more recovery ability is available for the areas that need it most. Let me walk you through a little bit of a sample routine, and I'll get into the specifics in a little bit, but just to kind of introduce some of the protocol. All exercises I do with somebody are essentially one set to failure within 60 to 90 seconds, and I'll break down the reason for all of this in future slides. So a sample workout would look like a leg abduction when you're trying to sit down and pull your knees apart from another, an adduction when you're trying to push your knees together, leg curl, leg extension, leg press, chest press, dumbbell row, shoulder press, underhand pull down. So sample full body workout for somebody that is very hip oriented. In general, I move as fast as safely possible between exercises. I like people to lift or lower weights as slow as possible. And the reason for this is the faster you lift a weight, the higher the force that you are producing. And especially if joint health is paramount, you want to do everything you can to reap the positive benefits of exercise without compromising joint safety. And there are 5 general trainable factors of functional ability that are positive benefits of exercise. There's muscular strength, cardiovascular health, flexibility, joint composition, finally improved body composition, more muscle, less fat. I track all the weights used, I track the exercises used, and I track the total time under load and other performance related. So let's talk through the workout a bit. Why are we doing what we're doing here? Well, why are we only doing one set of an exercise? In my opinion, if properly done, if you have a real qualified trainer, one set, if properly performed, I believe is every bit as effective as multiple set training. So the American Council on Exercise says that one set produces 80% of the results as multiple sets. But even if this is true, getting 80% of the results in a fraction of the time in half the amount of time of two sets or one third of the time as three sets, I'm going to err on the side of caution here. I will take 80% of the results by doing a fraction less volume and a fraction producing less forces on the joints. Why 60 to 90 seconds time under load? Well, it reduces the weight. If you were to perform conventional exercise, most conventional sets take maybe 15 to 30 seconds, but probably closer to about 20 seconds for a standard set of bicep curls or any other exercise. By stretching that time under load out longer, it automatically reduces the amount of weight that we're using, which will reduce the force that you're producing and also increases safety. Now, this equates to about 60 to 66% of your one repetition max, which is probably about the same number of weight that you're going to use if you were going to be performing between 15 and 20 conventional repetitions. Why do I have people lift really slow weights? Well, it increases the torque and reduces the shearing forces on your joints. Torque is essentially how much continual force your muscles have to produce to lift a weight, and shearing forces are forces produced in opposite directions. So the force velocity curve, and I've done a separate presentation on this, will show you why you have increased torque when you're lifting slower. But basically, it's more tension on the muscle, which is what we're trying to do. We're trying to safely overload the muscle to produce the positive benefits of exercise. And we're lifting slowly, which also minimizes the shearing forces produced. So more muscle overload with less force being produced on your muscle and on your joints. What the hell is time static contraction? I alluded to it earlier. It's a protocol for isometric exercise, but let's get into that a bit. Time static contraction is an isometric exercise, so no movement, but with gradually increasing effort. The way that it's normally done is the first 30 seconds of an exercise. You don't just immediately start pushing something as hard as you can. You gradually build up to this. Go from zero effort to maybe whatever interval of effort you're supposed to exert, maybe over the course of at least 5 seconds or so. You gradually build up tension in the muscles that you're trying to work. And during the first 30 seconds, you build up to about half as hard as you feel you can contract, about half as hard as you feel you can push or pull. And you're not doing many repetitions. You are constantly exerting whatever this level of effort feels like. Think of trying to push or pull against something that won't move, or trying to lift something that you can't lift. You're not trying to eke out lots of mini repetitions. It's a constant push or a constant pull. After 30 seconds, you gradually apply more force and you're pushing up to about 75% as hard as you feel you can exert yourself. 15 seconds after that, you gradually build up to about 90% of your max effort. This should be almost as hard as you can. And the wording is really precise for the last 15 or so seconds. You push as hard as you dare. Now, the reason that we are gradually building up over 90 seconds, change back to this view. Let's say that this is the amount of force that is required to produce an injury in a joint, especially if that joint has been compromised. If you go into a set nice and fresh, the amount of force that you're capable of producing initially is going to be far higher than that. So by having a longer time under load, something like 90 seconds, and gradually increasing the intensity, the amount of force that you're capable of producing over time gradually decreases as those muscles fatigue. And eventually it will decrease past the point that would be the amount of force necessary to produce an injury. So the whole idea of a time static contraction is to gradually build fatigue in the muscles so that when you're contracting as hard as you dare, and those are the last 15 seconds that are really going to get the full recruitment of all of the muscle fibers that you're capable of recruiting. By that point, your muscles are relatively fatigued so that the total amount of force that you're exerting is less than what could produce an injury. I mentioned it when I first started talking about this, but you want to gradually build up tension. And when that last 15 seconds is over, you don't just immediately end. You want to gradually back the tension off of your muscles again over the course of probably at least 5 or 6 seconds until you are done contracting. Time static contraction also has the benefit of allowing you to immediately and safely terminate an exercise if necessary. So, if you're doing a time static contraction shoulder press, let's say you're sitting on a shoulder press machine and you've loaded it up with more weight than you're capable of lifting, and you're pushing against it relatively hard. If at any point during this exercise, maybe you're 47 seconds in and something just doesn't feel right, you can safely deload the muscles and immediately end the exercise. If you're performing a more dynamic shoulder press, for example, even if you were lifting slowly, if you're halfway up through the range of movement or if you're most of the way up through the range of movement, something just doesn't feel right in your shoulder, wrist, elbow, you still have to safely lower that weight and then deload. And this can be more problematic if you're using free weights. So the real advantage of time static contraction is its ability to immediately and safely terminate an exercise if anything doesn't feel right at all. And I love using time static contraction on exercises for people that have joint issues almost exclusively because of this reason. However, in my opinion, a time static contraction is every bit as effective as dynamic exercise. Dynamic just means movement for the positive benefits of strength training, except for flexibility. Again, there's 5 general trainable factors of functional ability: increased muscular strength, cardiovascular conditioning, improved joint health. I already said flexibility is not really going to happen if you're doing isometric exercise and not moving. And finally, improved body composition, more muscle, less fat. In my opinion, if you are properly doing a time static contraction, it is every bit as effective for improving those other general trainable factors, except for flexibility. Why do I prioritize the exercises directly targeting that area? I already mentioned it earlier. Your focus and your concentration is the highest. So if I have somebody with a hip replacement, what I do with that client is I pre-exhaust the hips, the quads, and the hamstrings by doing adduction, abduction, leg extension, and leg curl, so that by the time that we get to the leg press, if we do a leg press at all, the load that we're using is significantly lighter. We're using far less weight because most of the legs are extremely fatigued by the time we get to the leg press. Now, I still think if we're able to, a leg press is a good exercise to include because looking at the muscles that we've worked in the lower body, we really haven't done much for the glutes. But we also want to make sure that the hips are in a position to where they're safe and they're not working with extremely high loads. Now, training this way may compromise glute overload in this one movement. Sure, you probably won't be able to leg press as much as you could if you were a healthy individual and you started with the leg press, but I do work in torso extension and hip hinging movements into other workouts to try and make up for this. So leg press if you're able, but you may need to use other movements. And again, isometrics are used a lot in physical therapy. His name eludes me now, but at a recent health fair, I shared a table with a doctor of physical therapy, and he talked about how he does isometrics, especially for knees with people, or even rehabbing like the Achilles tendon. He'll have people do isometrics, but he only has them do 20-second isometrics. And I explained the underlying methodology behind a time static contraction and why time static contractions are performed in that manner. And he was in agreement with the entire protocol. His only concern was he thought 90 seconds sounded like a really long time and could be extremely um, mentally intense. And he's right. Time static contractions can be very, very difficult mentally. But he was absolutely a big fan of the protocol. Next thing I want to say is there's no perfect workout. One routine is not enough. And I kind of alluded to this on the previous slide. So, regardless of what health condition you may have, if you're able, you also don't want to neglect neck flexion and extension and lateral flexion, which is just almost trying to move your head like trying to touch your ear. Wrist flexion and extension, grip strength, abs, lower back, calves, and even dorsiflexion should get some periodic work in your workout routines. So when you're doing calf raises, as they're conventionally called, it probably should be called the plantar flexion, where you're pointing your toe down and the rest of your legs are coming up. And you feel that contraction in the gastrocnemius, in the soleus on the backs of your lower legs. But we should work the other way too, trying to pull your toe back. That's the dorsiflexion. Now that can be a little bit harder to work, but it's still a muscle that you have. So you should be trying to work out all of the musculature of the body. And I comfortably and confidently say that you can work all of these areas despite any capability or any injury if you know what you're doing or if you have a trainer that knows what he's doing. So more broadly, I often say if you can move, if you can move, you can safely exercise. So most clients I have, I'll rotate through an A B split. So let's actually look at the training routine of my hip replacement client. Here's workout A. It's very hip focused. It's essentially the same workout that I alluded to earlier in the routine. Time static contraction abduction, trying to pull the knees apart. That directly articulates the hip. Time static contraction adduction works the interior of the pelvis. Leg curl, leg extension, leg press, chest press, dumbbell row, shoulder press, underhand pull down, wrist flexion and extension, and grip work. It's essentially a full body workout. Now, not everything was particularly covered in that workout. So I also rotate in a B workout. I'll keep the leg movements in there, but instead of the leg press, I'll do either some kind of like hip hinging torso extension movement, like a dumbbell stiff legged deadlift, or I will put my clients on one of those benches I have and do back hyperextensions, oftentimes with a weight if necessary, chest press, dumbbell row, rest of the workout. But instead, you can see I rotate neck flexion and extension and lateral flexion in here as well. Again, just because you have one area, even something as fundamental to movement as the hips, doesn't mean that you should be neglecting all of these other muscles that you have in your body. So backing up for people that have other issues, not just the hip, how do I adjust workouts to accommodate issues? And start thinking for yourself, if you have some limiting factor that's preventing you from performing conventional exercise, what are some things that you can do? Well, first, identify the functions of the muscle or the joint and how they move. And then identify the limiting factors of your conditions and consider how to work around it. So, people that have grip issues, I have people in my studio with carpal tunnel, rheumatoid arthritis, or lupus. You can do things like pre exhaust before a compound movement so that by the time you get to a compound movement, you're using less weight, which can get less pressure on some of these joints. And you also want to use slow repetitions. So, for somebody I have that has carpal tunnel, sometimes pushing on a chest press can feel really uncomfortable on the wrists. So I'll have them do basically a fly movement, doing a time static contraction, trying to squeeze two yoga blocks together. And right after that, with zero rest, we'll go right from the time static contraction fly into a chest press. And the amount of weight that we're using on the chest press is essentially usually ends up being right around half of whatever they would be doing if we just went into a normal chest press. Another thing that I have that's excellent for grip issues, especially on pulling movements, is I have a pull down machine and I have these elbow hooks. So the arm slides in here, goes behind the elbow, and you can pull down on pulling movements without any wrist involvement at all. Mobility issues. If somebody, again, can maybe only move their shoulder through a partial range of movement, then I'll do a partial range of movement exercise, or I'll do a timed static contraction. Things like this belt or a yoga belt can be excellent if want to do like a lateral raise for the medial delt, or maybe somebody has some rotator cuff issues but has a really limited range of movement. You can take a yoga belt or you can take this toe strap and you can essentially tie their elbows to their sides, and they can try and raise their elbows up even though they won't move anywhere, and they can safely contract those muscles even though their arms aren't actually going to move. Let's just say somebody has a extreme weakness. Well, you can prioritize using isolation movements and consider reducing volume on stronger muscle groups. And I talked about this earlier too. So I was consulting with someone that really struggles to walk and doesn't have a lot of lower body strength and struggles to curl her leg backwards more than maybe about 25 or 30 degrees. So with that individual, what I would do is I would lay them down, obviously not on the floor, but on like a massage table. I would have them lay on their stomach, and I would do probably isometric time static contractions, leg curls that way. And then I would reduce probably some of the upper body movements that I would do, because we really need to focus on building that leg strength so that she's first able to walk. And then as her leg strength improves, then we can start cycling more of these upper body movements in and out. Again, your body has a limited recovery ability. So if there are issues that it's more urgent that that area heals, depending on how big it is, depending on how weak it is, and depending on how hard you work it, I'm a big fan sometimes of limiting other movements so you have more recovery ability available for the areas that need it most. So, getting back to that lady that is struggling to walk, I would prioritize a lot of lower body movements. And if I saw her once a week or twice a week, every day that I saw her would probably have those lower body movements, but one day would probably be lower body plus upper body pushing movements. And the next time that I saw her, or the next week that I saw her, depending on her recovery ability, would be those same lower body movements, but then only upper body pulling movements. And again, we're trying to prioritize the areas that need it the most. If you have some other injury, like maybe you broke your arm and you just can't do anything with it and it has to sit in a sling, well, you can still train legs. You can still train, the other side of your body. And once that particular injury heals, when you're training it again, it'll catch up. It'll take some time, it'll catch up, but that's not an excuse to neglect the rest of the training that you should be doing with your body, anyways. Exercise is like brushing your teeth. You should do it because it's good for you. It doesn't have to be fun. It doesn't even necessarily have to be enjoyable. It's something you do because it's good for your health and it's good for you as a person. What else can you do? Well, I would highly recommend watching videos if you have a condition by physical therapists, personal trainers, chiropractors, medical doctors, sometimes massage therapists have really good information and knowledge of anatomy and physiology. Get as much information as you can from a wide variety of sources. I also recommend really focusing on diet to try and reduce inflammation. Best way to reduce inflammation with most people is trying to cut back carbohydrates as low as you can consistently have them. Get some grounding or earthing in. I'm going to do a whole separate video on grounding at some point, but basically, through normal cellular metabolism, the body produces a variety of what are called reactive oxygen species. And these are things that carry a strong positive charge. And because they're trying to become electrically neutral, they steal electrons from healthier molecules or healthier cells. So we hear a lot. This is why antioxidants are a thing. We're taught that we need to eat blueberries and strawberries and do things to increase our antioxidants to offset some of these reactive oxygen species. But grounding does the same thing. The earth carries a slightly negative charge. So if you have an earthing mat, if you have a grounding mat, if you just go outside and stand in the grass, because our bodies are essentially 70% water, our bodies will conduct electricity and we will essentially steal electrons from the earth that can offset these reactive oxygen species. Grounding absolutely does work and can be beneficial. Get the highest quality sleep you reasonably can. And when in doubt, seek professional help. Bart K is extremely knowledgeable. If you need to see a physical therapist, see a physical therapist. It's important that me, Jonathan, or anybody is well aware of their professional limitations. And there are certain conditions that I would not feel comfortable training. It's important to acknowledge that. But overall, your health and your well being in your life, these are your decisions that you have to make. And sometimes it's okay to admit that we need expertise. We need to find somebody who knows more than we do to get the help that we need. New York Times ran a study over 18 years showing I think 970,000 people got injuries from strength training within that window. And that equates to approximately 53,000 people every single year in the United States get injured from strength training. That number should be zero. Again, if we're exercising correctly, about physical therapy, if we're exercising correctly, it will have a net benefit, not only just on our bodies, not just on our muscles, not just on our heart, but also on our joints. Now, most of these injuries were related to free weights, and most free weight injuries are a result of bad form. But there's no reason, if you're doing things correctly, you should ever get hurt inside the gym. Just want to thank you guys for your time. I want to thank Jonathan for allowing me to come in and give this presentation today. If you have any questions at all, book a consultation with Jonathan. And the worst thing that Jonathan could tell you is basically things that I've said in this presentation. And he might recommend, depending on the condition, he might recommend, getting some professional help to deal specifically with that condition. But at least then you get an answer. You can feel free to reach out to me. Here's my email address. Here's my name. You can find me on YouTube. I want to thank everybody for your time. Thank you to Jonathan, and I hope this presentation helped.